Hey guys, what's up? Welcome back. So in this video we are going to discuss about the anatomy of the hip joint. This is the part 2 video. In this video we are going to discuss about the arterial supply, nerve supply, as well as the movements of the hip joint, and what are all the range of movements, about the muscles producing them, and also about the small discussion on the clinical correlation related to the hip joint. If you haven't watched the part 1 of this video, please make sure to watch that. In that video I have discussed about the basic ligaments, what are all the stability of the hip joint, and also about its relations and bursae. So make sure to watch that. So moving on to the anatomy of the hip joint in terms of its arterial supply. Arterial supply, or you can also call it as blood supply of the hip joint. So when it comes to the blood supply of the hip joint, it is actually supplied by the branches of some of the arteries. We have branches of the medial circumflex femoral artery, and also we have branches of the lateral circumflex femoral artery. What do we have? We have branches of the medial circumflex femoral artery as well as the lateral circumflex femoral artery, and these two branches are from the profunda femoris artery, right? Profunda femoris. Profunda femoris is branch of the femoral artery. So from the femoral artery we have the profunda femoris artery. This profunda femoris artery, it will give two branches. We have the medial circumflex femoral artery as well as the lateral circumflex femoral artery, and these two arteries will supply the hip joint. We also have some of the arteries. One is called as the obturator artery, and also it is supplied by the superior and the inferior gluteal artery. We have the superior as well as the inferior gluteal arteries. So these are the branches of the internal iliac artery, right? So these are the different blood supply of the hip joint. We have the medial circumflex femoral artery as well as the lateral circumflex femoral artery from the profunda femoris artery. We also have the obturator artery as well as superior and the inferior gluteal arteries, and this is about the blood supply of the hip joint. Now moving on to the nerve supply. So when it comes to the nerve supply of the hip joint, it is actually supplied by various nerves. What are the different nerves it is supplying? Firstly we have the femoral nerve. We have the femoral nerve via the nerve to rectus femoris, which supplies the hip joint, and afterwards we have a branch from the anterior division of the obturator nerve, and also about the branch from the accessory obturator nerve. We have obturator nerve as well as the accessory obturator nerve if it is present, and the obturator nerve if both are present, and a small branch from the femoral nerve. These all supply the hip joint. We also have some of the branches from the nerve to quadratus femoris, the superior gluteal nerve as well as the sciatic nerve. We have the superior glute nerve, and also we have some branches from the sciatic nerve as well as the nerve to quadratus femoris, and the branches from the superior gluteal nerve, sciatic nerve as well as the nerve to quadratus femoris, they all supply the hip joint. So this is about the nerve supply of the hip joint. Now we will discuss about the movements of the hip joint, or what are the different range of the movements and muscles producing them. So stick to the video till the end, and if you are new here, make sure to subscribe. So we will discuss about the movements of the hip joint. So what are the different movements that the hip joint can actually produce? The hip joint is able to undergo flexion, extension, can also undergo adduction, abduction, and also the medial rotation as well as the lateral rotation, and following all these movements it can also undergo circumduction. So what are the different movements that the hip joint can undergo? It can undergo flexion, it can undergo extension, adduction, abduction, medial rotation as well as the lateral rotation, and also it can undergo the sum of all these movements, that is the circumduction. So you need to know the meaning of all of these movements. So when it comes to the flexion ranges from the 110 to 120 degrees. The range is from the 110 to 120 degrees. When it comes to extension, it is only 15 degrees. When it comes to abduction, it ranges to up to 50 degrees, and when it comes to the medial rotation, that is at 25 degrees, and lateral rotation is able to do up to 60 degrees. So these are the different range of the movements. It is actually limited by the contact of the thigh with the abdomen, as well as the adduction is limited by the contact with the opposite thigh. So these are the different limits that range the movements of the hip joint. So we have, these are the different movements, and these are the different ranges of the movements that the hip joint can actually perform. So moving on to the muscles producing them. So it's a very important. What are the muscles which perform all of these movements? So when it comes to the flexion is produced by the psoas major, the iliacus, as well as the sartorius, rectus femoris, and pectineus. So I am telling you the psoas major as well as sartorius. Just remember 2 or 3 muscles, that is enough. Psoas major, sartorius. It also flexion is helped by rectus femoris, iliacus, as well as the pectineus. So when it comes to the extension is by the gluteus maximus as well as the hamstring muscles. Extension is by the glute max as well as the hamstring muscles. They help in the extension of the hip joint. So when it comes to the abduction is produced by the gluteus medius and the minimus, and also tensor fasciae lata and sartorius. Abduction is produced by the glute medius as well as the minimus, as well as it is also supported by the tensor fasciae lata and sartorius. And finally when it comes to the adduction is by the adductor muscles, which are the adductor longus, adductor brevis, and adductor magnus. So these are the different. It also includes the gracilis as well, gracilis and pectineus. So actually the adductor muscles will help in the adduction of the hip joint, that is the adductor longus, adductor brevis, adductor magnus, pectineus, and gracilis. Finally coming to the medial rotation is by the anterior fibers of the gluteus medius as well as the minimus. So actually glute medius and the minimus, they perform the medial rotation of the hip joint. And when it comes to the lateral rotation, it is performed by the other muscles of the gluteal region, which includes the piriformis, and also obturator internus, and also some of the associated gamellae, which is the superior and the inferior gamellae, quadratus femoris. So these are all the muscles of the gluteal region, right? And they perform the lateral rotation of the hip joint. So this is about the movements of the hip joint, and what are the different ranges it can move, and what are the different muscles it is actually able to move. So now we will discuss about the some of the clinical correlation that you need to know about the hip joint. And if you like my way of teaching, please make sure to subscribe, and you can share it to your other friends who want to learn more about the anatomy. So finally a small discussion on the clinical aspects of the hip joint. Small discussion on the clinical aspects of the hip joint. Sorry, it's not writing properly. So small discussion on the clinical aspects of the hip joint. So firstly we will discuss about the dislocation of the hip joint. Dislocation of hip joint. So when it comes to the dislocation of the hip joint, it can be congenital as well as the acquired. It can be congenital dislocation as well as the acquired dislocation of the hip joint. Congenital may be due to loose joint capsule, as well as it can also be due to hypoplasia of the acetabulum as well as the femoral head. And the acquired dislocation, it is rarely uncommon, and it may be majorly due to the automobile accidents which generally happen. So this is about the dislocation. The next one we will discuss about something called as the osteoarthritis. You know what is osteoarthritis, right? So it is actually a disease of the old age, and it is characterized by the growth of the osteophytes, and which actually eat the bone and making it like grating and painful. So this is about the osteoarthritis. And sometimes we have the something called as the referred pain from the hip joint can go all the way up to the knee joint as well. Referred pain can go all the way up to the knee joint. And also we have fractures of the femur. We also have fractures of femur which commonly occur due to the automobile accidents. So when you actually look at the femur, so this is the femur, head of the femur, and this is the greater and lesser trochanter and the body of the femur, right? And there are 4 different types of fractures. We have the subcapital, cervical, basal, as well as the pretrochanteric fracture. So when the fracture is just near the head of the femur like this is called as the subcapital fracture, and when it is little distal to it, it is called as the cervical fracture, and when it is little distal to it again, it is called as the basal fracture, and finally when it is on the trochanter, it is called as the pretrochanteric fracture. So don't worry, I'm going to write it. This is called as the subcapital, and this is called as the cervical, and this is called as the basal, and finally this is called as the pretrochanteric. So these are the 4 different types of fractures of the femur. We have the subcapital, cervical, basal as well as the pretrochanteric. So this is about the fracture of the femur. So finally this is about the small discussion on the clinical aspects of the femur. So thank you guys, I'll see you in the next video. Bye.